Welcome to EPG Pathshala on the subject Social Medicine and Community Health. I am Dr. C.P. Mishra, working as Professor in the Department of Community Medicine, Institute of Medical Sciences, Banaras Hindu University, and I shall be discussing the module National Rural Water Supply and Sanitation Program, which belongs to the paper National Health Programs and Policies. This module has been developed by a team comprising of myself, Dr. D.K. Taneja and Dr. Bhakti Banerjee. The learning objectives that has been set for this session is, number one, after going through this session, one should be able to describe the objectives and strategies of National Rural Drinking Water Program. Number two, one should be able to describe the objectives and strategies of Swachh Bharat Mission, Gramin. As we all know that health is basically determined by physical, mental, social environment. Among the physical environment, water occupies a very predominant position. Not only that, our body comprises of 60% of water. Water is required for our day-to-day activity, drinking, and other recreational activities. And unless water is provided in adequate quantities and it is safe for human consumption, probably we cannot ensure optimum health. There are several types of diseases that are related to water. One is waterborne diseases. It could be viral, protozoal, bacterial like cholera, viral like hepatitis, and in children particularly rotavirus. Diarrhea is quite predominant. So, supply of safe water and in sufficient quantities has been a major concern. Initially, there was a problem, properly known as problem villages, where a person has to walk more than 1.6 kilometers to take for water sources, and that lead to water scarcity and water contamination. It has been observed by several countries that health status of those populations are better where there is adequate quantity of water supplied, and someone has rightly said that number of functional traits should be taken as index of water quality. Water supply and sanitation are two basic requirements for human living and for promotion and preservation of good health. Basic sanitation is a necessity. If the sanitation practices are not adequate, that contaminate water too. And that is why Government of India started in the year 1999 Department of Drinking Water Supply under Ministry of Rural Development. In 2010, along with the Department of Drinking Water Supply, sanitation component was also added. This was renamed as Department of Drinking Water and Sanitation. In 2011, Department of Drinking Water and Sanitation was conferred the status of a separate ministry, and it was named as Ministry of Drinking Water and Sanitation. All these endeavors have been done just to emphasize the importance of safe water and basic sanitation in provision of health of the country for which the Government of India is committed. Water supply and sanitation conditions, the Government of India has launched Accelerated Rural Water Supply Program long back, and which went through several revisions over the decades. It is currently named as National Rural Water Supply Program with the vision to provide safe and adequate drinking water for all at all times in rural India. National Rural Water Supply Program has evolved over a period of time. In the year 1972-73, it was started an accelerated rural water supply program. In 1996, underwent into technology mission, and the technology mission on drinking water was initiated. All technology missions program got due impetus and due importance because these programs were directly reviewed by the Prime Minister of India. In 1991-1992, Rajiv Gandhi National Drinking Water Mission was initiated. In the year 2002, Swajal Dhara was started, and finally in 2009, National Drinking Water Program was initiated. The idea of initiating this program was to provide adequate and safe quantity of drinking water to the masses. The first objective has been to access to and use of safe drinking water within reasonable distance. Monitor and keep surveillance on drinking water sources. Third, ensure portability, reliability, sustainability, convenience, equity, and consumers' preference. Each and every what is important. Water must be safe, must be potable, but there must be reliable sources. Continuity of water supply over a period of time, and sustainability of the sources is important. The sources should be at a convenience place, and as a whole, there should be equity issues and other consumer preferences should be taken into account. The next objective has been providing drinking water facilities, especially piped water supply, to Gram Panchayats that have achieved open defecation free status on priority basis. This was given just to incentivize the sanitation measures by the local self-government. Ensure all government schools and Anganwadis have access to safe drinking water. Why this was done? Because school children in particular, and children in Anganwadi centers, their health is important, and their health can be ensured by providing adequate and safe drinking water. Besides that, school children in particular, it has been observed that 50% of the messages that are given to them are directly transmitted to the family members. So it can change, the school children can act as a change agent. We have observed that when the children come from the schools, generally they narrate what has happened in the school. Whatever habits that are inculcated in this formative stages of life is taken throughout the life. Next objective has been providing enabling support and environment for Panchayat Raj institutions and local communities to manage their own drinking water sources and systems in their villages. It has been observed that wherever there is a piped water supply systems are there, many times taps are broken. Many times it has been observed that hand pumps that are installed in rural areas, they are not in working conditions. And therefore, Panchayat Raj institutions' role become very, very vital in maintenance of these water sources, in conserving the water which is being wasted. The next objective has been to provide access to information through online reporting mechanisms and information placed in public domain. It is important that we should know that what is happening in our country in terms of this important initiative, and that is why the progress made, the facilities provided must be put in the public domain. Under this program, certain goals and a strategic plan of action has been involved, and this strategic plan refers from the year 2011 to 2022. The idea has been to ensure that every rural person has enough safe water for drinking purpose, for cooking purpose, and for other domestic needs, as well as livestock throughout the year, including during natural disaster. It has been worked out by expert group that on an average, a person will need 55 liters of water per day. It was also envisaged that by 2022, every rural person in the country will have access to 70 liters per capita per day within their household premises or at a horizontal or vertical distance of not more than 50 meters from their household within barriers of social or financial discrimination. Individual states can adopt higher quantity norms such as 100 liters per capita per day. Revised norms and criteria has been evolved also. There has been always emphasis on piped water supply rather than on hand pumps. The reason being that in hand pumps a lot of energy is also involved, and generally young girls and women are involved in managing water from these sources, and that is why their health is jeopardized. Enhancement of rural water supply from the norm of 40 liters per capita per day to 55 liters per capita per day to meet the daily requirements. It is also envisaged that by 2017, at least 50% of the rural population should have access to 55 liters per capita per day within their household premises or within horizontal vertical distance of not more than 100 meters, with at least 30% individuals household having their own connection. This distance business has been brought in the ambit of water supply because if the distance is more, the source, then people generally collect limited amount of water. They make compromises in using water, and once that is done, the quality of water is likely to be jeopardized. Another important point that needs to be considered that water storage practices at household level is very, very important. It has been observed that most of the contaminations also do take place at household level, and therefore water should be kept in a clean vessel, particularly for drinking purpose. It must be covered. A ladle used vessel should be used for taking out water from this. The next norm and criteria has been greater coverage for water quality affected habitations and continuum of supply, adopting 24 hours strategy for 7 days wherever possible should be done. This program has several important components. Component number 1, coverage for providing safe and adequate drinking water to unserved, partially served or slip-back habitations. Number 2, sustainability to encourage states to achieve drinking water security at the local level. Number 3, to provide potable drinking water to water quality affected habitations. If that is not done, then there will be outbreaks of many waterborne diseases. This is also vital during disasters, natural disasters or man-made disasters. Operation and maintenance for expenditure on running, water cost, repair, replacement cost of drinking water projects. Water quality monitoring and surveillance mechanism, particularly at the district level, and other support activities. These are some of the important program components that the program has envisaged. The program has also considered various other important issues. Considering the wide variations across the country, Government of India has ensured that flexibility must be provided to the states to choose the components under which funding is required. We can't go by a blanket approach. We have to take into cognizance the local problems and according funding facilities, need-based funding facilities should be ensured, and therefore decentralized planning in this area becomes vital. Drinking water to be provided to every public place by 2012-13. It has been observed earlier that in many public places there is no safe drinking water source, and that becomes a health risk. Drinking water facilities to be provided to the floating population by installing street stand post, particularly in the summer months. Many people search for water sources and they adopt water sources which are not safe for human consumption, and that becomes a cause of concern, and because that leads to them to various diseases. In the fitness of the objectives of 12th five-year plan, foster growth, inclusive growth, sustainable development. In this area also, the marginalized population, women, especially those belonging to scheduled caste, scheduled tribe, other backward caste, will constitute at least 50% of the members of Gram Panchayat, village water and sanitation committees. There is an urgent need to activate village water and sanitation committees, which has been recently going to be renamed as participatory councils at the village level, so that marginalized section of what people should not suffer on the area of water, in the provision of water facilities. There should be no compromise in terms of quality and quantity. Then incorporate other components like monitoring and surveillance. Surveillance refers to monitoring plus action. So simply monitoring water qualities will be not enough. Wherever there is a deviation, wherever the water quality is compromised, surveillance mechanisms should be brought into. And we must evaluate the program from time to time against predetermined objectives. In fact, evaluation is the degree of achievement against. So, in a time, because since the time frame, strategic frame has been worked out from 2011 to 2022, we must ensure that we are going on the right path on the basis of measurable indicators, and if necessary, mid-term corrections should be undertaken. Management information system is desired, should be invoked, because that will inform the program managers where they stand in terms of this. Research related to safe water supply, communication strategies, and what is their impact is desired, and all different development initiatives should be converged to get optimum dividend. The objectives are for this is monitoring and surveillance of all drinking water sources in the country by active involvement of community. So community-based monitoring and surveillance mechanism has to be evolved. Decentralization of water quality monitoring and surveillance of all rural drinking water sources in the country is needed. Why decentralization? Because then once it is decentralized, then sense of belonging comes. People realize that they are doing for themselves, and that is the desired thing for ensuring safe water supply. Institutionalization of community participation and involvement of Panchayat Raj institutions for water quality monitoring and surveillance. Desired generation of awareness among rural masses about water quality issues. Why this is important? Because unless people understand that why they need safe water, what is the importance of adequate quantity of water, and what are the various diseases or consequences related to unsafe water in terms of arsenic poisoning, in terms of waterborne diseases like bacterial diseases, cholera, diarrheal diseases, protozoal diseases, giardiasis, and viral diseases like hepatitis A. They will not make changes in their behavior and things will go down. Problems related to waterborne diseases are taking importance when a large number of water bodies, including even big rivers, are getting contaminated. And therefore it becomes pertinent that awareness building programs, initiatives should be taken so that people understand the importance of water quality and should initiate necessary measures. As I said earlier also, just to reiterate it, that most of the water gets contaminated in the home. So domestic or storage practices also becomes very pertinent. Building capacity of panchayats to take up full responsibility of operation and maintenance of all drinking water sources in their respective area. Hand pumps have been installed, water pipes are there, but many of them are non-functional. So if it is an outside agency is doing these repair business, then it takes time. And since panchayats have been given the responsibility for managing these things, it can be done within limited period of time. Water quality testing, for that lab services are needed. Say how to take sample, who will take sample, where it will be sent, and what will be done if the reports are adverse. These issues have to be taken into account. Training of human resource in these areas are vital. Information education and communication activities for creating demand-driven strategies for water quality and water quantity, and monitoring of the entire program in terms of safe water supply, in terms of maintenance of the various systems related to safe water supply is desired, and reporting of entire efforts are needed. Last but not least, funding is a key issue, and that has to be taken into account. Just now, we have discussed about water-related issues. If you look at the various components of environment, one is most important thing is the housing. Housing has been discussed somewhere separately. Then water supply, and there are 4 F's. The acronym F. First F is fecal disposal, and for that purpose, provision of sanitary latrines is desired. Then solid waste disposal, that second F refers to fly control, and that is closely related to solid waste disposal. The third F is food hygiene, and that entirely depends on the hygienic conditions and sanitation conditions prevailing in a particular area, because housefly density goes up, and that's the housefly sits on the food and transports various diseases, foodborne diseases. And last is finger hygiene. So after defecation particularly, or during preparation of food, or during serving of food, finger hygiene becomes important. So hand washing, which has been promoted by WHO, the methodology has been evolved. So people need to be educated about the practice hand washing practices and how one should do effectively hand washing. So sanitation area becomes of paramount importance because 3/4 of the surface water sources are polluted. 80% of the pollution is due to sewage alone. So sewage disposal in rural areas and in urban areas, open field defecation has been quite common in our country, and this has to be curbed. In fact, we have to eliminate open field defecation. We have to convert insanitary latrines into sanitary latrines, and also the manual scavenging, if it is prevailing, that has to be stopped. So Central Rural Sanitation Program that has been launched to improve the quality of life of the rural poor, also to provide privacy and dignity to women. Because in rural areas, open field defecation has been quite common, and that was affecting the privacy and dignity of the woman. The program underwent several modifications over the decades, and lastly, it has named as Swachh Bharat Mission. The Swachh Bharat Mission had evolved over a period of time. In 1986, Central Rural Sanitation Program was initiated. and 22 metamorphosis, and in 1999 total sanitary campaign has been initiated, which was converted to Nirmal Bharat Abhiyan in the year 2003. After 2003, there was a period when we started National Rural Health Mission. This National Rural Health Mission had, besides reproductive child health, disease control program, was addressing to the basic determinants of health like sanitation and nutrition component. And lastly, we have Swachh Bharat Abhiyan, which has been started with several aims and objectives. The first aim has been to stop total open field defecation. Second objective had been, objective and aim had been that we should convert all insanitary latrines into sanitary ones. And third has been eradication of manual scavenging, and so on. There are many aims that we had been stated. The objective of this program has been to bring about an improvement in the general quality of rural life in rural areas by promoting cleanliness, hygiene, eliminating open defecation. The present government is paying a lot of attention on this issue. A lot of measures have been initiated. Awareness campaigns have been started, and it has ensured that wherever person is, whether inside house, outside house, on the streets, in offices, in schools, in colleges, in transport systems, general cleanliness, hygiene should be ensured, and everybody has to say no to the open field defecation. We have to accelerate sanitation coverage in rural areas to achieve the vision of Swachh Bharat by 2nd October 2019. That target has been set. We have to motivate communities and Panchayat Raj institutions to adopt sustainable sanitation practices and facilities through awareness creation and health education. So awareness creation and health education has been identified as a very strong instrument to bring out behavioral change communication in the area of sanitation, in the area of adopting healthy practices, in the area of saying no to the open field defecation. Then one has to encourage cost-effective and appropriate technologies for ecologically safe and sustainable sanitation. For sustainable development, ecological considerations are very vital, and appropriate technology, which has been considered as an instrument for provision of primary health care besides intersectoral involvement and community participation, that should be encouraged. Develop, where required, community-managed sanitation systems, focusing on scientific solid and liquid waste management systems for overall cleanliness in the rural area. Compost pits were earlier there, but that has been disposal of solid waste disposal. In urban areas, a lot of procedures have been initiated because dumping of solid waste is a very big problem in urban areas and also in rural areas. Efficient mechanism must be involved. The strategies for moving towards Swachh Bharat by providing flexibility to the state governments. Financial flexibility have been accorded. Even implementation flexibility has been accorded to them because each state is on a different phase of development. Implementation framework of each state will be prepared with a roadmap of activities. Why roadmap? Because that will tell us precisely the direction on which one has to move, and also tell us precisely whether there is a lag or the particular state is moving in a particular direction. Covering the three important phases necessary for a program. Planning phase. Planning is a blueprint for action. Planning gives us a direction. Then whatever has been planned, whether it is being implemented properly or not, so implementation phase. And third is the sustainability phase. Say, for example, a particular program has run on a nice manner for a small period, and then we find that the program is going in the right direction, and then we stop financial inputs, and that then comes the sustainability issues. The components of the program are startup activities, and it is well said that well begun, half done. That philosophy operates here also. Startup activities should be taken in there. If it is well planned, probably the activities will be taken in the proper direction. For behavioral change communication, information education activities have to be undertaken. This information education activities may employ different channels. For example, we are using mass media. There are visual clips available through TV and also through radio, involving top personalities in the field to promote sanitation, to promote safe drinking water, and so on. So IEC activity, it becomes important. In fact, in public health practices, there are three approaches. One is legislative approach. So Government of India has already initiated several legislations to take care of environment. Another is providing services, and for service-based many initiatives have been taken. But the last but not least is educational approach. In fact, if educational approaches are adopted, initially there may be a delay, but once it takes up well, probably it will go on for a long period, and it will modify behavioral changes in the people, and that will be big difference. Capacity building is very important. Construction of individual household latrines, and also to ensuring that these latrines are being utilized. So water and latrine provision both should be there, so people find it to maintain it clean, and then they use it. Provision of revolving fund in the district for maintenance of these operations is desired. Microfinancing for construction of toilets. Maybe various approaches have been tried from time to time, and once people realize the importance of latrines, then if it is it becomes their need, they understand its need, then probably whatever latrine is constructed by the government will be utilized properly. Community sanitary complexes must be promoted. The distinct advantage will be that there will be no space crunch. Maintenance will be easier by lower cost, and probably utilization will be more. Equity and inclusion. The 12th plan has always said about inclusive policy. It means those who are marginalized, those who are disadvantaged, they must be brought into the umbrella of the overall development, whatever it is. Solid and liquid waste management, both in urban and rural areas, is a challenging task because of shrinking land areas, and then there are various administrative issues, particularly charges, that for that there should be a system of provision. Now, if anything has to happen, then there should be implementation mechanism. And this program, particularly related to water and sanitation, there are institutional mechanisms available. In this area, National Swachh Bharat Mission is there, State Swachh Bharat Mission is there, State Water and Sanitation Mission is there, and District Swachh Bharat Mission. And lastly but not least, we have Block Program Management Unit, and which manages all the programs at the block level. And then Gram Panchayat, Village Water and Sanitation Committee. Village level Water and Sanitation Committee has a very important role to play in provision of safe water. In order to optimize inputs given for sanitation, Government of India has started a program called Nirmal Gram Puraskar, and this is awarded on the following grounds. Number one, Gram Panchayats have adopted a resolution to ban open defecation within its entire area. All habitations within the Gram Panchayat jurisdiction have access to water for drinking and sanitation. Gram Panchayat has achieved objectives for all components entered in the MIS of the Ministry of Drinking Water and Sanitation. The 12th plan goal is that 50% of the Gram Panchayats will attain the Nirmal Gram status by the year 2070. Just to summarize, national programs launched under the Ministry of Drinking Water and Sanitation. National Rural Drinking Water Program strategic plans have been evolved for the year 2011 to 2022, prepared for rural drinking water sector to ensure that every rural person has enough safe water for all needs within a reasonable distance. Water quality monitoring and surveillance program is in vogue. Focus has undergone a paradigm shift from water supply in the village to water security at household level and ensuring quality. Quality issues have been brought in because that will take care of most of the waterborne, water wash, and other diseases. Swachh Bharat Mission has been initiated to ensure adequate sanitation. The objective is to improve general quality of life in the rural areas by promoting cleanliness, hygiene, and elimination of open field defecation. Thank you very much for visiting EPG Parts.